4 reasons why Italy's COVID-19 death rate so high. Italy has the highest COVID-19 death toll in the world as it tops 13,150. With over 110,000 confirmed cases, Italy has the highest death rate in the world, as compared to China, where the pandemic started. China has roughly 82,360 confirmed cases, but has only recorded 3,316 deaths. Italy has the second highest numbers of confirmed cases in the world after the United States of America, which stands at 209,071. So why is the death toll so high? Well, health experts have broken it down to a number of factors to consider. 1. The country's large elderly population. Italy has the oldest population in Europe, and has the second oldest population in the world after Japan. 23% of Italy's population are aged 65 or older. In Italy, 85.6% of those who have succumbed to the novel virus were over the age of 70. Many of those deaths have been of people in their 80s and 90s, a population known to be more susceptible to severe complications caused by COVID-19. 2. Distortion in numbers. The confirmed cases were distorted because not all infections had been recorded, and the country may have not been testing the mild cases of the novel virus. That distorted the numbers, and most likely meant that the number of those infected was much higher than what had been recorded, which in turn led to an increase in the mortality rate. Despite the Italian government having rolled out a series of measures to gradually stop the spread of the virus, by declaring a nationwide lockdown and shutdown of all non-essential businesses, Italy has been unable to flatten the curve. 3. Italy's healthcare system. Italy provides universal coverage and their healthcare is largely free of charge, but a healthcare system in a region like Lombardy with a high number of people who seek medical care can overwhelm the system, which leads to the healthcare system becoming strained. Considering that many of the elderly in Italy suffer from numerous illnesses. 48% of the elderly who succumbed to the virus had an average of 3 pre-existing illnesses, which meant their immune systems were weakened and made them more susceptible to COVID-19. 4. Social contact matrix. The novel virus can infect people of all ages, the most prone to succumbing to the virus being the elderly. While most of the elderly Italian population live by themselves, they are not isolated and their lives revolve and involve intense interaction with their children and the younger population. These interactions should have been decreased, and the elderly people should have been isolated and made more of a priority. These are some of the reasons why it is hard for Italy to flatten the curve and has led to their high mortality rate.